Hemorrhoids are enlarged or swollen veins in the lower rectum. You may be able to see or feel hemorrhoids around the outside of the anus or may be hidden from view inside the rectum. What symptoms will you experience with hemorrhoids? Hemorrhoids are more common in people who are older and in those who have constipation or diarrhea, during or after pregnancy, and in people who sit for prolonged periods of time. Symptoms of hemorrhoids can include painless rectal bleeding, anal itching or pain, tissue bulging around the anus, and leakage of feces or difficulty cleaning after a bowel movement. Many people with hemorrhoids notice bright red blood on the stool, in the toilet, or on the toilet paper after a bowel movement. The amount of blood is usually small. However, even a small amount of blood in the toilet bowl can cause the water to appear bright red, which can be frightening. While hemorrhoids are one of the most common reasons for rectal bleeding, there are more serious causes. It is not possible to know what is causing rectal bleeding unless you are examined. How do we diagnose hemorrhoids? To diagnose hemorrhoids, we will examine your rectum and anus and may insert a gloved finger into the rectum. If there is bleeding, testing should include a procedure that allows us to look inside the anus called anoscopy or the colon, colonoscopy. How do we treat hemorrhoids? There are measures you can take at home to relieve hemorrhoid symptoms. One of the most important steps in treating hemorrhoids is avoiding constipation by increasing fiber in your diet. Now this will soften your stools and bulk the stools. Fiber is found in fruits and vegetables. The recommended amount of dietary fiber is 20 to 35 grams per day. Several fiber supplements are available: psyllium, such as Metamucil, and wheat dextrin, such as Benefiber. If increasing fiber does not relieve your constipation, or if side effects of fiber are intolerable, you can try laxatives. Many people worry about laxatives regularly, fearing that they will not be able to have a bowel movement if the laxative is stopped. Laxatives are not addictive, and using laxatives does not increase your risk of constipation in the future. Instead, using a laxative may actually prevent long-term problems with constipation. We also recommend sitz baths, which is soaking the rectal area in warm water for 10 to 15 minutes, 2 to 3 times per day. Sitz baths are available at most drugstores. It is also possible to use a bathtub and sit into 2 to 3 inches of warm water. Do not add soap, bubble bath, or other additives in the water. Sitz baths work by improving blood flow and relaxing the muscle around the anus, called the internal anal sphincter. Various creams and suppositories are also available to treat hemorrhoids, and many are available without a prescription. Pain-relieving creams and hydrocortisone rectal suppositories may help relieve pain, inflammation, and itching, at least temporarily. You should not use the hemorrhoid creams and suppositories, particularly hydrocortisone, for longer than 1 week. If you have bothersome hemorrhoids after using conservative measures, you may want to consider rubber band ligation. It is the most widely used procedure for internal hemorrhoids. It relieves the symptoms in the majority of patients. Rubber bands are placed around the base of the internal hemorrhoid. As the blood supply is restricted, the hemorrhoid shrinks over the next several days, and many patients report a sense of tightness after the procedure, which may improve with warm sitz baths. Patients are encouraged to use fiber supplements to avoid constipation. Delayed bleeding may occur when the rubber band falls off, usually 2 to 4 days after the procedure. In some cases, a raw or sore area may develop 5 to 7 days following the procedure. Other less common complications of rubber band ligation include severe pain, thrombosis of other hemorrhoids, and a localized infection or pus formation called an abscess. Rubber band ligation rarely causes serious complications. If you continue to have symptoms from hemorrhoids, such as bleeding, pain, prolapse, despite medical therapies or rubber band ligation, you may require surgery. The surgical treatment for hemorrhoids is a hemorrhoidectomy, the surgical removal of excess hemorrhoidal tissues, which works for both internal and external hemorrhoids. Complications include recurrence in 5%, urine infection in 5%, bleeding in 2%, abscess in 1%, anal restriction in less than 1%, temporary fecal incontinence in less than 1%, and permanent incontinence in less than 0.1%.